Welcome back to From the Bathroom Floor. My name is Frank, and so far on this show, we've talked about a promising new treatment for people who've run out of options, and about the gap between being in clinical remission and actually feeling well. This week, I want to go somewhere that makes a lot of people with IBD a little uncomfortable. Not because it's gross, and we're way past that, by the way, but because it involves money and managers, and telling people at work something deeply personal about your body and your health. Today, we're talking about IBD in the workplace. And I want to be clear up front. This episode is going to be useful. I'm going to give you actual information based on research. But it's also going to be honest, because the practical stuff only matters if we first acknowledge how generally hard the situation is for so many people. Let's dive in. Here's a number that surprised me when I stumbled across it. Nearly 1 in 3 people with IBD has lost a job because of their disease. Not taking sick days, not have a rough patch at work, but lost a job. And only 2/3 of IBD patients are employed at any given time, which is significantly lower than the general population. And it's not just absenteeism, the days you can't get out of bed, the hospital stays, the infusion appointments that take up half a day. There's also what researchers called presenteeism. Showing up, being there physically, but running at maybe 60% because you're exhausted and anxious, and you spend 20 minutes in the bathroom before your first meeting. Studies show that overall work impairment in IBD, accounting for both, sits at around 40%. 40% of your productive capacity gone because your immune system is attacking your gut. And the financial cost of that? Well, researchers have calculated it at over $5,000 per patient per year in indirect costs. That's not medical bills. That's just lost work, lost output, and lost potential. And yet, when is the last time your specialist asked you how your job was going? Because for most of us, the answer is never. Or once, briefly at the end of an appointment maybe. The workplace impact of IBD is real. It is significant, and it is profoundly underaddressed in clinical care. So let's talk about that. This is important and practical. In many countries, IBD actually qualifies as a disability under the law, even if that word doesn't feel right to you, and even if you'd never describe yourself that way. What matters is that the legal protections exist, and a lot of people with IBD don't know they can access them. In the United States, the Americans with Disability Act, the ADA, covers people with IBD. It defines disability as a physical or mental impairment that substantially limits one or more major life activities. Eating, digesting, going to the bathroom, those actually count. If your disease affects your ability to do those things, and it flares unpredictably, you are very likely covered. That means your employer, if they have 15 or more employees, is required to provide what the law calls reasonable accommodations. So, what does that actually look like? It could be flexible scheduling, so you can attend infusion appointments. The ability to work from home on bad days. A desk closer to the bathroom, maybe. Modified break times. None of these are dramatic asks. None of them require you to perform poorly at your job. They just require your employer to be human about the fact that your body sometimes doesn't cooperate. In the UK, IBD is covered under the Equality Act. Same principle. If your condition has a substantial long-term effect on your ability to carry out your normal day-to-day activities, you're protected. And importantly, a condition that goes in and out of remission still counts as a disability under UK law. The fact that you look fine one month doesn't mean you weren't generally disabled in a previous month. It's important. If you're in Europe, like Switzerland, France, Germany, wherever, the protections vary by country, but the general principle holds. Chronic conditions that affect daily functioning have legal recognition, and you should look into what applies in your specific context. Now, accessing these protections usually requires disclosure. And that means telling your employer about your condition. And I know that's where a lot of people stop reading or stop listening because the idea of that specific conversation is terrifying. But here's the thing about telling your employer you have IBD. You should not have to do it. In an ideal world, nobody's bathroom habits would be their employer's business. But we don't live in that world. And not disclosing often means not getting enough support and suffering in silence while your performance quietly degrades and your stress levels quietly climb, which, as we know, can make IBD worse. The fear around disclosure is real and it is valid. People worry about being seen as unreliable, about being passed over for promotions, about colleagues treating them differently, about being managed out. And these things happen. But here's what else happens. Many employers, once they understand what IBD actually is, will accommodate it without a fight. The challenge is that most people outside this community have no idea what living with IBD actually means. They hear bowel disease and they think stomach issues. They don't picture the pain, the blood, the IV drips, the mental health toll, the fatigue that makes a full day often feel impossible. So part of disclosure is education. I always say you don't owe anyone a detailed explanation or description of your symptoms. You really don't. But having a simple, clear, and confident explanation of what IBD is and what you need can change the dynamic entirely. It could be something basic, like, I have a chronic inflammatory condition that affects my digestive system, and it's unpredictable. I can have periods where I'm completely fine and periods where I need more flexibility around appointments or working from home. I'm not asking for anything that affects my output, just some practical adjustments that help me manage it. That's it. That's the conversation. You don't have to say more than that if you don't want to. And if your employer responds badly to that, then you have information. Difficult information, but information you need. Look, the workplace aspect of IBD is one I think we'll come back to in the show in the future, because it's too big for just a few minutes, and because there are a lot of different situations. People who are self-employed, people in physical jobs, people who are early in their diagnosis and haven't figured out yet how sick they actually are, and people who've been sick for many years and have already lost so much, including hope. But I wanted to start here because the baseline matters, and that is you have rights. Your disease is real and recognized, legally and medically, even when it's invisible to everyone around you. And you deserve to be able to work and to build a career without your illness being held against you in ways it never legally should be. If you want to dig into the specifics for your country, and you're in the US, the Crohn's and Colitis Foundation has solid employment resources. And for the UK, Crohn's and Colitis UK has guidance as well. Next time, I want to talk about the IBD online community, social media, patient communities, the great and sometimes messy reality of finding your people and peace through a shared disease. Because it's not all about inspirational quotes. And I think we can have an honest conversation about both the power and the limits of that world. My name is Frank, and this is From the Bathroom Floor. If you're all about IBD awareness, subscribe to the show and share it with someone who needs it. I'll talk to you next time.